So these are the contents of the middle ear cavity, which is a air filled cavity. As I have stated already, it is having 6 walls. I have borrowed this box from my hospital to explain the walls of the middle ear cavity. This is the roof or superior wall. This wall is also known as the tegmental wall. This wall is floor, this is the roof, so this is the floor, and this part, the floor, is also known as jugular wall because this wall is related to jugular vein, the internal jugular vein and the bulb of the jugular vein, which is a continuation of the sigmoid sinus. This is the posterior wall. If I am talking about the right middle ear cavity, so this is the posterior wall. This wall is also known as the mastoid wall or mastoid surface because this is related to this mastoid process. Beneath this process, there are some mastoid air cells and the mastoid antrum, which is connected to middle ear cavity by attached to the mastoid antrum. This anterior wall, this wall is also known as carotid wall. This wall is related to the internal carotid artery and two tubes which accommodate the eustachian tube and the tensor tympani muscles. This is the lateral wall. If I am talking about the right cavity, this is the lateral wall. This lateral wall is formed by the medial surface of the tympanic membrane. So this surface is known as membranous surface or the tympanic surface, and this surface, which is the medial surface, this is also known as labyrinthine surface because this is related to labyrinth. So these are the 6 walls of the middle ear cavity. First of all, I will talk about the tegmental wall or superior surface or the roof. This is the lateral view of the skull. This is the anterior cranial fossa, the middle cranial fossa and the posterior cranial fossa. This part this is the anterior wall or the carotid wall. The posterior wall is here, also known as the mastoid wall or mastoid surface. This is the floor which is formed by jugular wall and it is formed by a thin plate which is formed by the petrous part of the temporal bone. This part is also formed by temporal bone, and simply this opening is inside the temporal bone, especially in the petrous part of the temporal bone. So this is the tegmental wall. This is formed by a thin plate. It is having a thin plate. This thin plate is known as tag-band tympani. This thin plate is known as tag-band tympani. This is very thin plate. The word tagman is used sometimes for the roof, and it is roofing the tympanum or the tympanic cavity. So this is tagman tympani, and above this part there is a layer or covering of the brain, the meninges. So this is covered by the meninges, and above these meninges there is temporal lobe of the cerebrum. So floor or tegmental wall is formed by a thin plate known as tagman tympani. This plate is running backward and roofing the canal of the tensor tympani muscle. So it is roofing the tensor tympani muscle, the muscle which is tensor for tympanic membrane, and pull of the muscle is towards medially, and it makes the tympanic membrane tense, and part which becomes tense due to pull of this muscle is known as pars tensor. So also roofing the canal for the tensor tympani. What happens in newborns and children? This part remains open and it is known as petrosquamous suture. The petrosquamous suture but when this suture is ossified, there will be small opening in this plate, and this will accommodate a vein. This vein will drain the blood from middle ear cavity to the superior petrosal sinus. Again, in newborn and in children, this part of the roof or tegmental wall of the middle ear cavity is opened. But when this part, the petrosquamous suture, is ossified and closed, it is having a small opening which will transmit a vein. This vein will drain the part of the middle ear cavity into the superior petrosal sinus. Sometimes the infection of the middle ear cavity in case of otitis media or some thrombus of the middle ear cavity can be transmitted to the superior petrosal sinus, which may be life-threatening in some cases. So this is the roof or tegmental wall of the middle ear cavity. Now I will talk about the floor. This part is the floor, and this floor is again formed by a thin plate of the bone, which is a part of the petrous temporal bone. So this is flooring the middle ear cavity. And it is related to the superior bulb of the internal jugular vein. Three nerves are running with the internal jugular vein through the jugular foramen, the 9th glossopharyngeal, the 10th vagus, and the spinal SLC nerve, which is accessory to the vagus nerve, but also having some fibers from the upper cervical segments of the spinal cord. A small branch from the glossopharyngeal known as tympanic branch is running inside the tympanic cavity through the tympanic canaliculi. So this is the tympanic canaliculi. This nerve will indent the promontory. Promontory is elevation formed in its medial wall by the central or the circles of the cochlea. So it will indent the promontory and it will form a nerve plexus. This nerve plexus will innervate the mucosa of the middle ear, but it is also having some preganglionic parasympathetic fibers which will origin through the lesser petrosal nerve from this tympanic plexus. So there is formation of the tympanic plexus, and it will give the lesser petrosal nerve. The fibers from the lesser petrosal nerve will terminate in the otic ganglia, and from the otic ganglia through the auriculotemporal nerve, the parotid salivary gland is innervated. So it is having some fibers for the pain, touch, pressure, and some fibers which are visceral efferent for the parotid gland are running through this tympanic branch of the glossopharyngeal nerve. It is also related to the superior valve of the jugular vein, and it is having a small plate. Sometimes this plate is absent in some cases. In that cases, the upper part or wall of the jugular vein is only partition or delineation between the middle ear cavity and the jugular vein. So this is the floor or inferior part or the jugular wall of the middle ear cavity. Now I will talk about the posterior wall or the mastoid wall. I have stated earlier this part, this is the mastoid process. This mastoid process is having the mastoid hair cells and the mastoid antrum. What is mastoid antrum and what are the mastoid hair cells? I will talk in detail in my next lecture, but here only the mastoid wall of the middle ear cavity. So this beautiful place is the mastoid process, and these alveoli like spaces, the air filled spaces, are mastoid air cells. These are the mastoid air cells. So these are the mastoid air cells. This is the mastoid antrum. And this is the adductus to mastoid antrum. So the posterior wall, this wall is the posterior wall. This wall is having the adductus to the mastoid antrum, which is connecting the mastoid antrum and the tympanic cavity, and this part is the mastoid air cells. The anterior wall, this anterior wall is related to canal of the tensor tympani muscle and the auditory tube, or also known as Eustachian tube. So this is the canal for the tensor tympani muscle. Here we can see the pharyngo-tympanic tube, also known as Eustachian tube or auditory tube. The posterior wall is related to adductus and the mastoid antrum and air cells. These all are forming a structure like a pistil. I will explain how these are forming the pistil like structure. So again, the roof, floor, the anterior wall, which is also known as the carotid wall, because this part is related to the internal carotid artery. This plate of the bone between the anterior wall and between the internal carotid artery, is forming posterior wall of the carotid canal. So this is the carotid canal and it is partitioned by a thin plate which is forming the posterior wall of the carotid canal. After a short break, I will talk in detail about this fistle.